everyone. Welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, welcome. It's great to see you here. Listen, we've got some action-packed stuff that we're doing. We're having some exciting conversations with some real leaders that are painstakingly reshaping the future of health and healthcare and care delivery. And we're pretty passionate about a few different areas. We're passionate about healthcare innovation, leadership, access, the adoption of that innovation. So if it's your first time tuning in, let me just sort of take a quick step back and tell you a little bit more about what we're trying to get done here. So our focus is on bringing real stories of innovation and leadership to life. So the aim is actually highlighting real people that are actually getting stuff done, and giving them the opportunity to share their stories, share their wins, share their learnings with our community and ultimately with the world. And if you haven't checked out any of the historical interviews, wherever you are, if you're watching this, if you're listening to this, please hit the subscribe button now so that any of the new interviews come directly to you. So today's guest is Frank Sawyer. So Frank isn't someone who studied healthcare from the outside. He ran it. He spent more than a decade inside of hospitals and health systems, including serving as a hospital CEO. And that means that he lived with the consequences of decisions, big decisions, the budget pressure, the physician dynamics, the board expectations, the reality that every great idea has to survive operations, culture, and trust. So this experience matters immensely. So because, when Frank talks about innovation and growth or partnerships, he's not guessing how a health system is going to react. I mean, he's been the one that's responsible for making it work or explaining why it couldn't. So what also stands out to me is sort of his personality and how he applies leadership. So Frank's very open about how he shows up, as a husband, as a father, as a son, as a brother, and as a friend. So those roles really sort of shape how he leads, how he listens, and it shows up in how he kind of brings people together. So his style is deeply collaborative. He believes that the best outcomes come from breaking silos, from respecting different disciplines, and creating space for real dialogue. So this isn't about sort of selling the room or posturing. It's really about actually working through the hard stuff together. So this conversation for me is really about what healthcare leaders see, that founders, maybe sometimes often miss or have a certain set of assumptions that aren't necessarily fully validated. So we want to talk about why execution breaks down, why trust is really the real constraint, and what it takes to kind of bridge the gap between good intentions and real impact. So buckle up, stay tuned. Frank, it's great to see you. Welcome to the show.
Yeah, Michael, excited to be here. Been looking forward to this conversation. We met down in Austin, Texas
That's
at the
right.
Healthcare Innovation Summit. Hit it off quickly. When my wife and I returned home, she's like, "You need to connect with that guy and figure out how to partner up." So, like any good husband, I took her advice, and we're
Yes.
doing this today. So I
Yes.
look forward to
Right
this.
on. Yeah, of course, man. Happy to do it. It's always good, serendipitously when you meet people in the right ways, in the right context, when you're aligned. Things are good for that. Look, most people, they think hospital CEOs spend their days making big decisions, which is true. But what they don't see are the nights spent carrying decisions that don't have clean answers. So, Frank, I don't want to sort of start out with what you've done. I think I want to start out like what's stayed with you. So when you think about some of the decisions that you've made as a hospital CEO, like kind of what followed on when you took a decision, went home, sat with it at the dinner table. Any one of those decisions kind of come to mind that you're able to kind of speak about?
Yeah, I love that as an intro question. And just as a point of clarification, I was a hospital chief operating officer,
Got it.
not a CEO, but was tasked with making those hard decisions and implementing those hard decisions with great impact. Really what you grapple with is how to make decisions with incomplete information, how to make decisions where there is imperfect information and there is no clean answer. There is no playbook. Healthcare has so many intractable problems that, if there was a way to do it, you would just be doing it. And
Hmm.
with every decision, you're burdened with the impact to people, be it your workforce, be it patients, be it the board, be it the community. And so the stakes feel very high, and none of them are kind of loosey-goosey decisions. When you're in those executive seats, you have to understand all the dynamics, all the stakeholders, all the risk points, and get to the best answer you possibly can, understanding it may work, it may not. And you have to have contingency plans for any possible outcome that could occur.
Mm. When you're kind of sitting with a lot of those decisions, does anybody actually know how much pressure you're truly under?
Yeah, in a word, no. Your peers do, but when you're making a decision that is going to impact one, two, 3,000 employees, that if it goes poorly, you'll end up in the media, under scrutiny, or you could cost the company millions and millions of dollars, and at the end of the day, it's on you to make the recommendation, sell it, execute it, and make sure it works. Like, there are a lot of nights where you're up in the middle of the night staring at the ceiling, you know, thinking through it, wondering, how this is going to go, and just trying to put your team and your organization in a position to make the most of it.
I think about being put in pressure situations. You take a lump of coal and you apply a pressure on it, it becomes a diamond. You kind of get hardened. Curious, what do you take with you now when you're kind of trying to process decisions, when you're in pressure type situations? What are the good things that you take with you when you're trying to kind of go through like a decision matrix? Can you describe how you process situations, audibly so that so just someone who's listening kind of gets a glimpse as sort of your framework?
Yeah. First step is slow everything down in your mind. Don't let the pressure get to you. Talk to as many people as you can, leverage as many people and relationships as you can, whether it's in your organization, in your field, or outside of your field. I like to say, put as many smart people in a room as you possibly can and gather as much info as you can to make the best possible decision. An
Mm,
axiom that I have that, I stole from, one of my favorite sportscasters is it's not about being right, it's about getting it right. And so as the leader, kind of humble yourself to know it doesn't have to be my idea, it doesn't have to be my way. Let's
mm,
get the best idea and the best way and go with that, and try to remove ego and pride from the process to get to the right solution. Recognizing that's really hard for people to do, particularly for people in leadership who we all are usually type A. We all have egos of some sort. And there's a reflexive human nature of, if it's my neck out there, I want it to be my call. But you've got to back away from that, be inclusive, you know, draw out people's ideas, because countless times in my career, the right answer came from left field that you didn't expect, where you didn't expect to get it. And over
mm,
time, you learn who's not talking, who's not contributing, who am I not asking? Because sometimes the quiet person in the background knows exactly what should be done. And then in the healthcare setting, get as close to the bedside or the front lines as you can, and
mm,
make sure you're asking those people. I don't care if it's the most junior housekeeper or the OR nurse or whomever, like, don't conceive of a plan without getting it to the front lines first, or someone on the front lines who can vet it to make sure that you've thought of everything.
mm. There's a subtle difference, and you mentioned it, talking about being right versus getting it right. There's a 2 millimeter difference there that is massive. And what I have found, what you shared is like, look, the best leaders, they get to the right decision. They get it through having conversations. They ultimately take the decision. But for them, it's not about necessarily always just being right. It's about getting it right. And just everything going on. There's a lot of noise in our space. It seems to me that there's more headlines around leaders taking decisions to be right versus getting it right. At the time
Mhm.
that we're having this conversation, there's multiple nursing strikes that are going on. How does that sit with you as a former operator? What does that sort of stir up inside of you?
Yeah, so I was just in New York City with a client a couple weeks ago, walking down the street. There's, nurses picketing because they had literally just gone on strike in New York City. Um, and some of the crowd on the corner looked down the street and asked, what's going on down there? And in true not New York fashion, like I started talking to the stranger next to me, and I'm like, oh, it's a nursing strike, and here's what I know about it. And multiple people, as we're waiting on the stoplight, look over at me and like, well, we need nurses. So I hope the administrators figure it out. Whatever they want, we need them. And so to your question, you've got a workforce that we as a society need them more than they need us. They are the thing that enables us to deliver care. How do we take good care of them? I don't think as an industry we've done a good job in the post-pandemic world of doing that. We pivoted after the pandemic and never really leaned back into our workforces, be it nurses or other, and ask the questions, are you okay? What do you need coming out of that? What should we build moving forward? We went from a place of supreme exhaustion to now just run faster because we have to innovate and repair and recover the financial standing of the organization. And I would advise all leaders, and you have leaders and organizations that are doing this, but slow down, lean into the entirety of the workforce because without them, there is no care delivery, there is no better health, there is no outcomes, there are no outcomes that we need to achieve within the healthcare sector.
I just remembering now, back to our dinner we had in Austin. You were sharing some pretty crazy stories about that time, about what you were doing. Um, do any of those kind of come to mind when you think about the sheer exhaustion that leaders are under now and the sheer pressure that they're under? Can you kind of go back to that time, frame it up for us to kind of talk about, all right, here we are today, but like a lot of these events are what sort of escalated it to that point because now you're obviously sitting in a different seat. You're not operating anymore. Um, Maybe talk to the amount. I don't know if it's just you, but I'm seeing a lot of transitions, like folks that are just tired and like, hey, I'm not doing this anymore. I'm getting out of the seat. I'm seeing this a lot more,
A lot.
and it's kind of scary.
It is. It is. When we go back to 2020, what I think people on the outside don't realize is how little information we had, how little we actually knew what we were doing because there was no data, there was no science. We were doing the best we could, winging it on a literal day-to-day basis, whether it was supply chain, infrastructure, or patient care. And what I was struck by was the ingenuity and the ability to figure it out quickly and in real time to provide better care and to achieve the objective, the mission. And when you think about healthcare, it's a very slow moving and stagnant industry, but under the most pressure the industry has ever been under, we figured it out rapidly. What for me led me to transition is I've always been a, forward thinker. I'm not change averse at all. I'm probably a little too risk tolerant on the innovation front, but we've now proved in real life under the most pressure what is possible from an innovation standpoint.
Mm,
And then after the pandemic, too many of the systems and processes snap back to the old way of doing and thinking and conservatism around risk and innovation. And for those who could see what it could be, who know from experience that it needs to be better, to be reshackled to no or minimal innovation and let's go very slow and conservative, it it shifted things in my mind and said, you know what? Maybe we can drive change forward better from a different vantage point, leveraging the expertise, the relationships, the knowledge of what needs to be done and what could be done, and help those who are focused on innovation connect and do
yeah.
that better from the outside in.
Mm. So somebody who's looking from the outside, looking towards the inside, what behavior inside of hospitals do outsiders criticize that actually makes sense once you're responsible for a lot of this sort of these downside risks that you're taking on.
Yeah, it comes back to the patient. So the decisions all terminate in it could impact someone's health and well-being or even their life, right?
Yeah.
So the experiment that you want to run from an innovation and technology side, if I'm on the hospital side, if we screw this up, we could, not saying we will, but we could hurt people very, very badly, right?
Hmm.
And so it provides a certain level of hesitancy and rigor that is required to move that forward. The second answer I'll give you is there are so many competing resources for dollars
Right.
politically inside a hospital that if an executive is going to take a leap and sponsor an innovation, well, that individual might be risking their credibility, their
Hmm.
job, and thus their livelihood. Or at minimum, their next opportunity to try something else. Because if you try something big and you fail, well, you might not get another shot. And so there's systemic risk, but there's also personal risk to the executive champion that I don't think folks fully appreciate. And then when you look at scale across all the leaders of an organization or an industry, it just isn't going to necessarily move as fast as you might think it should on the outside because everyone is weighing those risks both for, the system and themselves all the time.
Mm. And when you think about the seat that you're in now, and you get to kind of disrupt from the outside going in, what is the what's the filter that you use to kind of decide what innovations are worth actually
Mhm.
bringing to colleagues and peers? Where do you see things that can be innovated and done well, where there's an asymmetrical, you know, risk reward, small risk, big reward? Where do you see that? And what are some of the patterns that you've been able to kind of pick up?
Yeah, absolutely. So, rewinding, being in the game on the inside for just over 20 years, right? And working my way up from ground level up to C-suite. You know what's broken, you know what the needs are, you know what strategies and tactics work and don't work, and you know how to stand things up operationally, to make sure that they have long-term success and aren't just a brief experiment, right? And so I try to focus innovators from the outside on, that small subset of things that really move the needle. Every hospital, and I've talked about this before, every hospital cares deeply about patient experience,
Hmm.
staff or colleague engagement and experience, their financials, so grow new revenue or decrease cost, and clinical quality outcomes. And so focus on those big bucket problems in a way where you can demonstrate outcomes, whether it's whatever the outcome measure is in those four domains. If you approach a hospital with, I want to solve, or I think I can solve this problem in one or more of these, one of these four buckets or all of these buckets, you're immediately de-risking, right?
That's right.
Because when we're coming from an industry standpoint, we're overwhelmed with new things, new softwares, new medical devices that promise the world, but don't really move the needle in any of those domains in any real measurable, sustainable way. So we're a bit jaded. We've been sold a lot over the years, and so we're highly skeptical and been burned. But if you can show in your product or your solution directly how we're going to impact one of those four measures, you can get folks to lean in because those are the four problems that they're laying up at night thinking about, how do we solve those because they've never been able to be sustainably solved before.
Yeah, to me, it's you focus on the things that aren't going to be changing anytime soon. And I've written
Hmm.
about this. It's like, hey, look,
Yep.
last time I checked, a patient's going to want to get in to be seen pretty quickly, whether it's virtual or in person. That ain't changing. A patient's going to want to be treated nicely. They don't want to be treated poorly when they go in somewhere. And then thirdly, clinicians, they want to be working in top of license and they want to work at a place where they feel valued and where they feel like they're being respected. And
Absolutely.
there's a lot of opportunity for improvement in those areas. And it's astounding to me that folks aren't trying to innovate in those areas. They're just like, hey, let's do this over here. This is kind of cool. It's kind of shiny. And you're like, wait, dude, don't you know how a hospital operates? We do this, and this. It's like, focus on
Focus.
that. What other myths do innovators from the outside get wrong about, a health system that you've observed over the years?
Mhm. Um, I think there's a big myth around the financial structure of hospitals and health systems. Um, they have money, they cash flow a lot of money, but the margins are razor thin. When you talk to industry companies and, our objective is to make 15, 20, 25% margin. Like, we're hoping to make 3 to 5 in a good year in this climate and want to be above zero. And so it costs so much to run a hospital in totality. It's like running a city. When you think about it, you've got all the same parts and pieces of running a big city. That's what you're doing. And so there's not a lot left over, at the end
Mm,
of every month or every year. And so, like in someone's personal finances, if you're on a really tight budget, you've got to make really hard decisions. And you do want to put your dollars on the things that are going to be the most impactful in this example to your family or your
hmm
well-being.
hmm
And if you're the hospital, it's to the broader business of patient care and the community, um, because the overwhelming majority of health systems don't have deep pockets where they can just throw tens of millions of dollars around. There are some that do, but 95% of them are in that tight household budget situation. And so if you have a great idea, you've got to thread that needle so that you can be, one of those dollars that does get spent on something new and creative.
Were you always innovative? Were you always someone that's kind of embraced the risk on things? Because just presuming as you climb the ladder, I'm curious if that was sort of what stood out to you, or what others saw stood out to you about, like, hey, you were willing to innovate.
Yeah, I think it's as I've gotten older, I've accepted it's just how I'm wired. From the earliest days of my career, I looked at like how do we make this thing run better, smarter, faster, so we can do more good.
Yeah.
You talk to my teams, that I worked with. I had this phrase: "If you want me to never leave you alone, tell me this is how it's always been done." Like that was a phrase that I would just latch on to, like a dog with a bone, because I'm like, if it's always been that way, then that probably means it needs to change. And the why behind that is if everything in our world is changing at a ever more rapid pace, why would we think that's fine just to stay where it is exactly? If you're not changing, if you're not going forward, you're going backwards, And so over time, I realized I'm just wired to look at things in a constant, like, how do we make that better, more enjoyable, more effective, more efficient? It's a gift and a curse. I'm sure it drives my
Yeah.
wife crazy because I'm always trying to like tweak and make something better, but within the healthcare sector, I think it's needed.
Yeah, I mean, listen, you're basically an engineer. You look at processes and you just see where they're broken, and then you just want to make improvements. I mean, that's human-centered design in a
Mhm.
sense, and you're now doing it at a much greater scale. Where from like a transformation standpoint, where are the bottlenecks that health systems, you know, have today, and what are some things that you think they can do to kind of break through some of those bottlenecks?
Yeah. When I look at our health system, I think how we move patients through our physical and digital assets is a giant opportunity. Uh,
Mm,
we have enough beds, we have enough spaces, we have enough offices, but we don't have enough if our mindset is cram everybody through bricks and mortars. And it's why hospitals keep building, 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 which is ironic because we don't have the money to keep building and building and building and then still service the debt that comes with the financing of the constant construction. Uh, if we leverage technologies through various virtual and telemedicine capabilities so that folks who don't need to be physically present can get exactly what they need, how they want it remotely, so that our
Mm.
physical infrastructure, our hard infrastructure is reserved for people who absolutely need it. And we can help the society transition to that sort of model. I think that unlocks giant opportunity and solves that access bottleneck. I know there are naysayers out there, but what I will counter with is we've done this in every other industry. I was a late adopter to Amazon Prime and Amazon delivery, but you know what? I don't need to go to bricks and mortar stores 90% of the time. Various services that you can now get digitally through bots without having to interact with, booking a plane ticket as an example. So in almost every other aspect of our life, the industries have figured out how to provide an experience that delights the customer and simplifies their life and
Hmm.
preserves bricks and mortar resources for that which is required. But healthcare has not yet fully leaned into that. And I can tell you, as someone who's done, virtual, care for myself or my family, um, in 90% of instances, I love it and it's far superior. If I do need bricks and mortar, that person on the other end can always triage me to
Yep.
where I need to go without having to have that wasted trip, and now in our family, like that is the first move, right? And so the opportunity is there, but we've got to present it in a way where society leans in and chooses it and not let our fear from the inside industry side say, oh, we can't do that because dot dot dot.
Well, is that more of leaders now coming into more influential roles within a health system that aren't necessarily tech savvy, rather they're more tech dependent. They grew up with a smartphone and they view innovation now as like it's not nice to have anymore. This is like a must have. Do you see that happening now where they start to embrace this type where it's not just traditional, like, hey, we have this building, we have these rooms, we must fill these rooms. But now they're thinking, like you said, they've got these digital assets. Like, wait, we've got these rooms, we've got these digital rooms that we must fill. I mean, fundamentally, that's kind of a big shift.
It
And that
is.
I think it just takes someone that is more tech dependent. At least this is my thesis because
Hmm.
we're starting to see more and more go down that road. Um, and there might be a point in time where, quite frankly, there are virtual towers that are filled as opposed to physical towers.
Yeah. Yeah. The optimist in me says that is the inevitable, destination that we get to as healthcare leaders live more, tech infused lives. It's only a matter of time until they bring that to their profession. I
Yeah.
think battling entrenched ways of thinking and incentive structures that are still pulling towards the old way will be the challenge. But I do think more and more leaders are not just having the realization, but are starting to figure out how to have the courage to push for those big leaps forward, at risk, accepting the risk that that might entail, and part of one of the
Mm,
challenges I see from the healthcare leader field is it is safe to not take risks, right? You don't read about healthcare leaders losing their jobs because they didn't hit a metric or they didn't perform and achieve the goals, right? And we're approaching a world where you're going to have to infuse technology to meet goals.
mm,
So in that bridge time period, and I'm not advocating for, healthcare leaders who don't achieve what they need to achieve to, you've got to get fired. But I do think we're going to have to realign incentive structures to
mm.
take us to the future world rather than rewarding playing it safe and sticking with the old rules.
That's interesting. That's pretty fascinating. Now, when you're in some of those meetings, behind closed doors, that I'll just say transformers and innovators from the outside are likely, they're never going to get invited into that room. Okay. They're not
Correct.
going to be in those rooms. Who inside of that room has influence
Mm.
more influence than their titles are actually suggesting? And why do people listen to them inside of that room?
Yeah. So first half of that question then is I don't know that innovators from the outside fully appreciate how many stakeholders have equal power and equal say. It's a little bit like Congress, where you've got to whip a whole lot of votes and keep them in line to get anything done. No
Hmm.
one person in that room typically has the entire say. And I see folks from the outside think if we just get this one person that has the right juice or the right title, they'll push this through. That's not how it works. You've got the finance leader, you've got the IT leader, you've got legal and compliance, and you've got, your CEO or your COO or your CNO or your CMO, depending on what the topic is, right?
Mm.
Um, the sneaky, powerful role in the room is the IT executive, right? That can stomp out the best idea, can not overrule, but short circuit, unplug even what the CEO wants, because the undergirding of the organization, that central line of the organization is the IT infrastructure. And if they're not on board, you know, you're not moving forward. And so,
Mm.
engaging and cultivating that role, I think, is massive. Getting the finance executive on board early, given that a lot of solutions cost a lot of money, and making sure they believe in the ROI financially, that's another key one. I found that CEOs, COOs, chief nurses, and chief medical officers, like those are the easy ones because they possess the problem that you're trying to solve. And of course, they want to solve said problem, right? It's
Right.
those other two columns that are farther removed, but are absolutely critical to getting anything off the ground that I think I would encourage all innovations coming from the outside cultivate that relationship and understanding much more than is currently done.
External innovators are under a lot of pressure, and
Yes.
sometimes they've got a shorter runway
Yes.
where um, the long game matters. They want to know that when you're taking a decision, and hold me to this, but like when you were taking a decision, how much of that decision was factored in is like, is this company funded? Is this company going to be around in 3 years from now?
Mhm.
Like, how long term were you thinking? And how much does that weigh when you're deciding whether or not to take a bet on someone or an organization?
That right there is a massive consideration, right? And the timelines of the hospital side and the timelines of the innovation side are vastly misaligned. One thing I've enjoyed about working on the tech side is they all know their cash on hand, their burn rate, how much time they have until that clock hits zero and their
Yeah.
company is out of business. And so the urgency that they move with, I love. On the hospital side, it's completely flipped and they want to go slowly. And so there is a challenge there where I think we've got to figure out how to meet in the middle, um, because of just the natural real life pressures that those founders and innovators have. In terms of the length of time or the lifespan of the innovation companies, that is a consideration on the hospital side. There are times when I want to proof a concept, I want to do the experiment to demonstrate that this new way of thinking or doing is viable,
Right.
more so than I have to find the right solution for forever and ever right now. In those instances, those companies that don't have a long, lifespan pre-built in are
Hmm.
fine. If I'm trying to find, my one forever solution for this problem, I absolutely need to know that you're going to be here in 3 or 5 or 10 years. And if, one thing I look for is what are the goals of your company? Like if your startup, you're looking to build it just big enough to flip it and sell it to someone else, you're probably not the right partner for a large health system because then all that work goes away because the acquiring entity might not care about the direction that you're on. And now we've done all this for nothing. And so it gets back to understanding what's the problem we're trying to solve it and what's the right solution and what's the right partner. There are lanes for them both, but understanding that due diligence on the front side is important. And I don't know that a lot of hospital executives are adept at understanding what type of innovation company is this and where do they fit into that longer term or shorter term plan.
Yeah, look, there's one thing that I've seen is like they all got nice decks. They got nice decks, and they certainly try to present a good, clear story. And you know, a lot of it hinges on like what channel does it come through?
Mhm.
You as a former operator, I'm just sort of curious, how much of that weighed into your decision? Which doorway it came through? Does that go a long way for you?
Um, Less so because I know that those people are just trying to get in the door any way they can. Um, where I focused on is, are they solving the right and a meaningful problem?
Mm,
And then making sure you get the people that are most vested in that problem to the table. And so I've worked with clients where we've got, this C-suiter. Well, that's great. They're your intro. They got you in the door, but they can't carry it anywhere because that's not their domain. Make sure that in your next meeting, this is who you need at the table for this topic. This is how the decision will get made. This is how it's going to spread out through the organization. You know, Pulling people in early is always better than late.
Curious, are there any parts of the job, historical job that you miss that kind of surprises you that you miss?
Um, Oh yeah, absolutely. There's a lot I don't miss, but
Yeah.
um, the people, uh, the human connection. What I
Mm,
loved about a hospital is just the diversity of intellects and backgrounds in the professional field. You've got doctors, nurses, pharmacists, engineers, architects, physicists, you know, all the trades, and so many more. And so just the different people and personality types and lenses that you could interface with every single day was hugely additive to me, not just as a professional, but as a person. Um, the second thing I will say is the care delivery environment is the best learning lab for perspective and
mm,
resilience. You see people having the best day of their life. You have see people having the worst day of their life and everything in between. And it helps you stay centered, grounded, and count your blessings on a day-to-day basis because
absolutely.
you can always see people like, my worst day is still 100 times better than the day that person is having right now. And to be able to
Mm,
go home with that every day and just thank the good Lord for what you did, what you do have, was a gift every day for that 20 years.
mm. What is, I guess, kind of share with the audience, like, what's the best way people can kind of follow your work? I mean, you obviously been super active. Give us a little bit of a commercial, and then we'll kind of try to move on towards wrapping up here.
Yeah, absolutely. And thank you for that question. So, this summer, I departed the hospital and health system landscape and started my own company called Health Forward, can be found at healthforward.io. And it's all about helping innovators, those that are innovating for and aspiring to sell into hospitals and systems, figure out how to do just that better and faster. I focus on those who are trying to drive meaningful, measurable change in those domains that I described, with particular topics and causes that I'm most passionate about. So, whether it's pediatrics or behavioral health or surgery or emergency medicine or just hospital operations in general, I support organizations that are trying to do big, meaningful things to help patients, hospital workers, our broader communities.
Mm,
I'm getting ready to do a more public launch, so follow me on LinkedIn, Frank Sawyer,
okay.
look for this face. Go to my website and some other content items moving forward. But, if you are on the health tech innovation side and you're trying to figure out, go to market strategies, go to market work, how to navigate the complexity that are hospitals and health systems. And if you've traveled that journey and are ready to stand something up and operationalize it, I'm your guy. If you're a busy health system or hospital exec who wants to know what's coming, what's out there, what's the best way to solve this problem that I have, I've immersed myself in all things health tech and have a great lens in terms of companies and products that could solve their day-to-day lives. And if you just want to talk about it and kind of brainstorm and what's coming, where do we need to go on either side of the fence? I love having those conversations, meeting folks and learning about people's different worldviews as they try to conquer this giant problem.
Yeah, I think it's a team sport. You got to have
Absolutely.
people that want to dance. And I guess I would say if there's knowing what you know now, right? If you could speak to your younger self,
Mm.
is there any bits of advice that you would leave with your younger emerging Frank as you were climbing up that ladder? What would you share with that younger Frank?
Yeah, and you just hit on it. It's a people business. There's a lot of tech, there are a lot of aspects to it, but at the end of the day, it's about the human relationships, solving problems, getting the most out of every critical role that is involved, um, and understand, listen to, and wrap your arms around all those groups.
That's
One
right.
thing we learned in the pandemic was we had this pesky little phrase called essential workers, even within healthcare. What is essential and what is not? Well, you know what we learned? All of it is essential. Can't do a hospital without food services. Can't do hospitals without lab workers or housekeepers. Obviously, you can't do it without nurses and doctors, but it's an ecosystem where you need every single role we have. And as a leader, your job is the whole team and making sure all the parts and pieces work together to drive that outcome. And so, you know, 20 something year old Frank, that's what I would say. Immerse yourself in all the roles, personalities, professions, because there's going to come a day where you need every single one of them to get to where you want to go for the hospital.
Yeah, you're basically just saying, like, look, sometimes we got blinders on.
Hmm.
Let's take the blinders off a little bit. And it could even be said as innovators. As innovators, sometimes you're so fixated on that problem. And you're like, well, this is the
Yep.
problem. Meanwhile, does that problem really land on the prioritization person that
You
really
got
is
it.
going to deploy it? And if it doesn't, the market's telling you something. There's a signal there.
Hmm.
So this has been a really enlightening conversation, Frank, because as someone who sat in the seat, you're basically kind of giving a roadmap. And you've been very gracious around sharing a lot of those insights. And my hope is that if you're listening to this, probably gonna have to listen to it a few different times. If you're really trying to move into a health system, this one is for you. Because at the end of the day, it starts with an awareness of things. And by the way, if there is a topic, if you're listening to this, if there's a topic that you want us to explore or a leader that you want to hear from, drop us a note. Let us know. Comment, like it, share it. And if you found this conversation to be really helpful, then the best thing to do would be to share it and to share it with your community and share it with your network. This platform, it's not just about content. It's about community. And healthcare is a team sport. So even if it's not serving you directly, serve those around you. So thanks for listening. Keep building with purpose, and we'll see you next time on the Advancing Health Innovation Show. Thanks for joining, Frank.
All right. Thank you, Michael.